Is your gallbladder to blame for your abdominal pain? Keep watching to find out and to learn what to do about it. Hi there, my name is Amanda Malicheski. I'm a certified functional nutrition health coach and a digestive and allergy detective, which means that I help you figure out what's going on with your digestion and why, and what you can do to resolve it. Please consider subscribing to my channel and be sure to hit the bell to be notified when I post a new video every week. So before we dive in today, I just want to take a quick moment to give you a disclaimer about this video. If you have severe or persistent abdominal pain, please do not delay in going to speak with your medical provider. This video is not meant as a substitute for medical advice. That said, gallbladder attacks are a frequent cause of abdominal pain, and despite the fact that they're miserable, there is a lot that you can do in your day-to-day life to prevent them from happening in the first place or to stop them from happening. So in today's video, I'm going to share with you things that you can do to either stop your gallbladder attacks altogether or things you can do to prevent them in the first place. My client Erica used these techniques to stop her multiple days a week attacks of abdominal pain. She didn't know that they might be related to her gallbladder, but she did know that when she had them, she would have to lie down and stop working. So using the tips I'm about to share with you, she was able to resolve her attacks and be feeling a lot better. And I know that you can too, so let's get started. So what the heck is your gallbladder anyway? It's basically a tiny little organ that's a bag that holds the bile that your liver produces and saves it until the body needs it, and then it releases it into the small intestine when you eat dietary fats. The bile helps emulsify the fats so that they become water soluble and that you can actually absorb the fats into your body. But your gallbladder can produce stones, which can get stuck in the little ducts in the gallbladder, and when it tries to release bile, it squeezes on these little plugged ducts, and this can hurt a lot. If the ducts get really blocked or your bile gets really thick and sludgy inside the gallbladder, your doctor may recommend removing your gallbladder. And in fact, this is the most common operation that happens in the United States. But I personally think it's worth trying to avoid cutting out our organs if we can, and instead to work to support the function of our organs. Symptoms of gallstones or gallbladder attacks are often somewhat intense or sudden pain in the upper right quadrant of your abdomen, kind of right under your rib cage. This is where the liver is, and the gallbladder is right in the center of the liver, kind of underneath it. But gallbladder pain can also radiate to the shoulder blade in the back or elsewhere on your back, or also other places in your abdomen, and it can also be accompanied by some nausea. So these are the common signs that you're having a gallbladder attack. And the pain can often come on after eating a fatty meal or a fatty food or another trigger food. So how to resolve gallbladder pain or gallbladder attacks? The first thing I'm going to tell you is that I don't recommend you do the liver and gallbladder flushes you might have read about elsewhere on the internet, which involves drinking a lot of olive oil with lemon juice in it and all this stuff. If you're not properly prepared for this technique, it can lead to a medical emergency by clogging up those ducts in the gallbladder. I prefer first to start with some more gentle, slow healing attempts to work to support the gallbladder and help it clear out first. It's important to think about this with a strategic approach. And the very first thing that I want to encourage you to do is to work to understand the food triggers that are causing the problem. The most common food that causes a gallbladder attack is, like I mentioned, fatty foods. So these could be fried foods, fatty meats, dairy products, or other high-fat foods. One of my clients gets gallbladder attacks whenever she eats pork or other fatty meat. And so we've had her remove those foods from her diet, and this has really helped reduce the frequency of her attacks. Another common gallbladder trigger food are eggs. A lot of people who have gallbladder attacks are having a sensitivity to eggs, so this is something to consider. And the other lesser well-known gallbladder attack trigger food is gluten. So you want to work to try and understand what your food triggers are that are triggering these pain attacks. So you might want to try eliminating one or more of these foods to see if this makes a difference for you. If you're not sure which foods are causing your attacks, I recommend using a food symptom diary. I'll leave a link for mine below this video so you can go ahead and grab that. And if you need a little bit more support or help using that food symptom guide, I have another video that teaches you how to use it. It's called How to Use a Food Diary for IBS. So it's important to realize that though removing the trigger foods may help reduce the frequency of the attacks or may remove them altogether, it doesn't deal with the underlying problem, which is that your gallbladder is having gallstones or is getting backed up and having pain attacks. So now I want to talk about what we should do about that. So the next thing I want to ask you to do is to support your stomach acid. Our stomach acid declines as we age, and this may be a reason why more older people tend to have trouble with their gallbladders. But adequate stomach acid is one of the ways that the body signals to the gallbladder to promote bile flow or to release bile into the small intestine. And so if we don't have enough stomach acid, our bile flow may kind of get backed up, and this can lead to stone formation. A simple tip to increase your stomach acid is just to drink a little bit of apple cider vinegar or lemon juice in about an ounce of water before your meals. It's that easy. But if you need a little bit more support on this, you can head over to watch my earlier video called How to Increase Stomach Acid for Digestive Support. The third step you can take is to support your fat digestion by taking a digestive enzyme with lipase in it. Lipase helps your body break down the dietary fats that you're eating, and this fat digestion support may help take some of the burden off of your gallbladder. I have a lot more information about digestive enzymes and other basic digestive supports in my earlier video titled Supplements to Help Digestion and IBS. Finally, the fourth thing that might help is something called castor oil packs. To do a castor oil pack, you saturate a piece of flannel with some castor oil, which you can get at your health food store in the health and beauty aids department, and then laying it over your liver and gallbladder area, and then covering that with either a heating pad or a hot water bottle and just hanging out and relaxing for 15 to 30 minutes. It's very nourishing and relaxing and can actually help generally improve not only the bile flow, but the lymphatic flow in the area of your liver and gallbladder. And this can help not only your gallbladder, but lots of other parts of your health. If you've had a lot of pain attacks, don't use the heat for the first week or two. Just do the castor oil over your liver and leave it at that. So I'm curious to hear from you if you've had gallbladder attacks. I'm wondering what you have done to help yourself feel better. Leave me a comment down below. So I hope this video has helped give you some ideas about where you can start and where you can move towards in a strategic way to resolve your gallbladder issues. So I encourage you to try some new things and see how you do. Though these tips may help, they really are just part of the customized and holistic approach I use with my one-on-one private clients. So if you think that you're someone who might benefit from that kind of support, I really invite you to download the Roadmap to Gut Recovery. It's a free action guide that can help you get started right away to start figuring out what's causing your digestive symptoms and how to resolve them. You can download that by visiting confluencenutrition.com/roadmap, and I will be sure and leave a link for that below this video. Or if you've tried all these tips and you haven't gotten anywhere with your pain attacks, there may be a lot of other factors involved, and you might need a little bit more expert help thinking through the different possibilities and working on finding your path to success. So if this sounds like you, I would like to invite you to schedule yourself a free 30-minute consultation with me. I offer this to people to get started just talking with me. We can talk through what's going on. I can try and identify some of the missed healing opportunities that no one's seen before for you and give you some things you can do right away. And then we can also talk about what it might be like to work together. So you can schedule that free 30-minute assessment session by heading over to my webpage at confluencenutrition.com/contact, and I will also leave a link for that below this video. Until next time, I wish you the best of luck resolving your gallbladder symptoms, and I will see you all next week.